Welcome to 20-Minute Health Talk, where some of the brightest minds in healthcare help us break down the latest news and developments. I'm your host, Rob Hoyle, alongside my co-host, Chris Guzewski, and today's special guest, Dr. Michael Nimaroff, who's the Senior Vice President of Ob-Gyn at Northwell and the Chairman of Ob-Gyn at North Shore University Hospital and the LIJ Medical Center, Katz Women's Hospitals. Also, special guest today joining us virtually is Elizabeth Espinal, who is a research coordinator for the Feinstein Institutes of Medical Research, and she is also pregnant in her second trimester. And Dr. Nimaroff, I'm sure you're getting 1,000,001 questions about the vaccine and pregnancy.
Certainly, before we talk about the vaccine, we have to remember that COVID infection during pregnancy is extremely serious. Okay, majority of patients are asymptomatic, fortunately, so no one should panic. But certainly, developing an infection during pregnancy can lead to really serious outcomes, both for the baby, the pregnancy, for the mother, and this includes, even death. Unfortunately, the vaccine was not yet tested in pregnant patients. There were patients who received the vaccine in the trial, and they were pregnant. They didn't know they were pregnant at the time of the entry into the trial, but they were pregnant, and it does not appear that any of them had any adverse events. So we do believe it's a safe vaccination.
So Elizabeth, just listening to Dr. Nimaroff, you are pregnant. So did you decide to get the vaccine?
I did decide to get this vaccine. A big piece of my decision was based on that I'm hearing that from the doctors, and me being a researcher myself, I turned to the data. And a lot of the data that I found is exactly what Dr. Nimaroff described. There were some women who were pregnant during the trial without knowing initially that they were pregnant. There were no adverse effects observed as a result of that. In the end, all roads basically led to it makes more sense to get the vaccine than to continue sort of worrying on the edge. I'm pregnant and there's this danger out there to me and my child. But if I have something to sort of put a barrier between that, then I should do it.
What was your experience like?
There's a lot of nervous energy around the vaccine in general, not just specific to pregnant women. So you could sort of sense that in the air, but I think it was overall a positive experience. The injection itself was fine, just like receiving any other injection, a flu shot or any other a Tdap. And afterwards, I think you have to sort of wait a bit. And when you're pregnant, they make you wait a little bit longer just to monitor you and make sure that everything was all right afterwards, and everything was fine, thankfully. In the end, all I had was a sore arm. So,
Dr. Nimaroff, obviously this hasn't rolled out to the public yet, but when it does, is this is Elizabeth's experience here? Is this something that we can really use to show that this is safe?
Yeah, absolutely. Thank you, Elizabeth, for sharing your story, and I think it's important. You need to talk to your doctor. Of course, patients should. It's not a simple decision. But certainly we think it's the right decision. Our organizations, American College of Obstetrics and Gynecology, as well as the Society for Maternal Fetal Medicine and other organizations all support vaccination during pregnancy or when contemplating pregnancy. One issue that has come up is the question, this is again, some false information regarding does the vaccine lead to infertility problems? So difficulty getting pregnant. And so this has been looked at. The Society of Reproductive Medicine, American Society, ASRM, has issued also their statement saying that absolutely not, and that certainly women who are contemplating pregnancy or who are undergoing infertility treatment should go ahead and get vaccinated. The only studies that we do have, actually, there's some studies that have shown that in men, that COVID infection, having an infection can lower the sperm count and therefore lead to male factor infertility. So it's important, obviously, for both parties to get vaccinated.
Now, Elizabeth got the vaccine, so she's protected. Does that vaccine also go to protect her unborn child?
So it's a good question. So we haven't seen incidents of transmitting the virus from mom to baby in utero. So it's called, we have not seen that, although there are some isolated reports like here and there of overwhelming infection where actually it looks like there may be some transplacental passage, but overall that does not happen. We've seen, we actually have had over 1,000 COVID positive deliveries, patients who are, already throughout the system throughout this. Fortunately, it really has been, a very asymptomatic infection for the newborn. That's believed because, again, there is some protection because there are antibodies that do pass through the placenta that help protect the baby. So vaccination, we don't have data on this yet, but certainly can potentially also help the newborn initially.
Yeah. And Elizabeth, you being from the research field, you're going to go with the science and the data. What was the information that you were getting from friends and family?
So I'll start with the conversation with my husband. My husband is a chef, so he's really not a part of the healthcare world in any way. So he had a lot of sort of concerns that I think a typical layperson would, and similar conversations with my parents and friends that asked me about it. So I felt it was sort of my job to just give them a little bit of education as to why I was making the decision that I was making, and just make it a decision that's informed and not one that's based on fear. That's really my message to people.
All right, great. Well, we're getting close to the end of our show here, and we always like to end on a positive note. So I'm going to hit both of you. But so, Dr. Nimaroff, what gives you hope and optimism?
We all know people who have COVID infection now. I mean, it's everywhere. But fortunately, still the numbers in the hospitals are not as bad as they were. And it looks like we're heading sort of, again, even in hospitalizations, heading in the right direction. We should be optimistic that we're going to get through this.
That's great. And Elizabeth, what gives you hope?
As a pregnant woman, I am optimistic that this will sort of change the tides a bit on COVID. The vaccine will change the tides a bit on COVID. And being pregnant during COVID is very difficult. It's really quite stressful. You really have to be isolated. And it's not how you typically want to experience a pregnancy. This is my first, and it's definitely not how I wanted to experience my first pregnancy. And I know many other women who are struggling with similar situations. So this gives me hope that pregnant women will have to deal with this for too much longer and can sort of experience the joys of pregnancy instead of feeling quite afraid.
That's awesome.
Amen to that.
Yeah, absolutely.
That's great. All right. Elizabeth, Dr. Nimaroff, thank you so much for joining us. For everybody who tuned in, thank you so much. Have a great week and stay safe.